Hello, we are Group 6, and today we are going to introduce asthma. Asthma is a chronic disease that affects the respiratory system, specifically the bronchi and bronchioles. In a person with asthma, their smooth muscle around the airway is very sensitive to triggers. When a trigger is encountered, the smooth muscle contracts, which is known as bronchospasm, and it immediately narrows the airway. Also, the airway lining swells. The airway will be infiltrated with a lot of inflammatory cells, which this process is known as inflammation. This leads to the airways being further narrowed. Mucus is also secreted during asthma. The mucus makes the airway smaller and reduces way for oxygen to get into the lungs. These processes will lead to wheezing, coughing, chest tightness, and shortness of breath. In the long term, if asthma is not well controlled, permanent damage to the lungs might happen. This is called airway remodeling, which the airway walls become thicker and stiffer, and the smooth muscle layer also becomes thicker. This change is usually irreversible, and it makes asthma more serious. Asthma is not caused by pathogen and is non-infectious, so it cannot be transmitted among people. Instead, it is caused by genetic and environmental factors. There are many risk factors that triggers asthma. First, genetics. If you have a parent with asthma, your risk is higher. Second, there are several environmental triggers, such as indoor mold or fungi, dust and allergens, cigarette smoke, and air pollution. Third, there are some other risk factors. During pregnancy, weight gaining, obesity, stress, and smoking of the mother might lead to a higher risk of the baby developing asthma. In Hong Kong, the risk of developing asthma is high. Firstly, there's a high level of air pollution due to the high traffic and industrial activities. Secondly, there's a dense population in Hong Kong. These two factors make it easier to inhale dust, indoor mold, fungi, and secondhand cigarette smoke, which leads to a higher risk of developing asthma, especially for children.
I will be talking about how asthma causes to its symptoms and what happens if asthma is untreated. So first, let's talk about how asthma causes to its symptoms. Firstly, asthma will cause airway narrowing. The smooth muscle around the bronchi is very sensitive, exposing it to allergens such as dust will make it contract strongly, making airways narrower and harder to do airflow. This will lead to the patient to have wheezing and chest tightness. The patient will also suffer from harder breathing because the muscle is contracting, which makes the airway is more narrow, and the air will be a lot harder to do airflow. In addition, asthma will also cause excess mucus production. Excess mucus secretion will happen when our body's immune system reacts with allergies, infections, irritations, or inflammations. This will force our mucus secreting cell to produce a lot of excess mucus to trap the allergen or the bacteria. However, this is not a good situation because these excess mucus will cause a more frequent coughing for patient to cough the mucus away from our body. This will also cause the shortness of breathing because it can it because the because mucus will have make the airway a lot narrow and the air have a lot less space to do air to do airflow and to do gas exchange, which will lead to a shortness of breathing. Now, let's talk about what happens if asthma is untreated. Firstly, it will cause potential obesity or diabetes. Untreated asthma will greatly reduce the effectiveness of breathing, which will make the patient's stamina is a lot weaker. In this situation, patients will tend to engage in a lot less physical activities. Over time, the patients will have a relatively low energy output, which may lead to a high blood pressure, diabetes, or obesity occurs. In addition, it will also cause a higher infection rate. And untreated asthma can over time lead to a persistent inflammation in our airway, which will greatly disrupt our immune response because it will lead to the immune system to have handled the inflammation first instead of handling the bacteria or the viruses in our body. This will greatly reduce the effectiveness of clearing the virus in our body, leading to a greater chance of having a serious infection such as pneumonia or tuberculosis.
Hi, so let's move on to the next topic and dive deep into the possible treatments to relieve symptoms and cure asthma. So, to start off, inhaling relievers are taken for immediate relief of asthma symptoms. It works by relaxing the swollen pseudostratificulum epithelium, the inner lining of the airway, and also the smooth muscle that's wrapped around bronchioles, thus widening the airway to allow more air to pass through. Asthma preventers can also be inhaled regularly for long-term treatment. The mechanism works by reducing inflammation to keep the airway open. By taking 3 to 4 times a week, depending on the type of medicine you're taking, they reduce the swelling of airway and excess mucus secretion in the wall of bronchus when they're triggered. However, it takes at least 2 weeks of usage to get the full benefit. There are a few alternatives management to reduce the symptoms of asthma. Firstly, recognize triggers and prevent them is the key. Preventing interactions with major triggers in allergic individuals, such as petting animals and visiting gardens, can minimize the chance of triggering asthma in those who are sensitive to them. You may also undergo bronchial thermoplasty. It works by applying heat to the smooth muscle around the lungs and strengthening them, killing the muscle tissue partially to keep the airway open, when medication isn't applicable in relieving the symptoms of asthma. However, this treatment needs to be accompanied by the usage of medicine such as inhaler. So let's move on to the topic about how common asthma is around the world. There's an estimated 260 million people diagnosed with asthma in 2025, causing it to become one of the most common chronic diseases worldwide. In Hong Kong, approximately 10% of children and 5% of adults suffer from asthma. While asthma remains one of the global health concerns, scientists are trying to figure out how to treat asthma permanently. According to the latest experiment conducted at Austin University, the researchers aim to apply the technology of liver-targeted immunotherapy to cure asthma. This experimental asthma treatment reprograms the immune system by attaching sugar molecules to allergens, allowing them to bypass immune attacks and reach the liver. The liver then prompts regulatory T cells to stop inflammation, creating immune tolerance. In mice, just 2 doses provide up to a year of protection, reducing airway inflammation. However, this treatment has only been tested in animals and is not yet available for humans. While there are promising results and tests conducting at the same time, it still takes time to provide treatments to cure asthma permanently. Thank you.